Mobley, who works with medical marijuana and medical marijuana patients.
Thank you. My name is Gil Mobley, M-O-B-L-E-Y, for the record, and I have a clinic in Federal Way. We do disability determinations, and I wanted to just call your attention to a talk I gave yesterday. I'm not going to be repeating that. It'll probably be on YouTube. It's from the Hemporium and from the main stage, actually. It was the top 10 stupidest things about Washington State's medical marijuana laws. And there are some really stupid things that are going on in this state where patients are paying for it with their lives, their family, their income, their future. There's some really stupid things going on. You can hear that. I'm not going to go through the top 10 stupid things, but they all ended with the crowd doing a recantation of why it was a problem. It was because your officials, our officials in Olympia, have been derelict in their duty to correct the problems that have been ongoing since the citizens passed this initiative more than 12 years ago. We're still defining what is a plant. Is it just a stem without roots? And patients are running the hard way through the court system because Olympia is dragging their feet. That is a problem. But I want to shift the emphasis to medical marijuana just for a moment, and what type of patients is it appropriate for. And the first thing that I want to bring, since the theme of this year's Hempfest is harm reduction and responsible use, is we must remember smoking trashes your lungs, folks. It does. And you've got to learn to vaporize. It is without the tar load, it's without the carcinogens, those things that cause cancer. So as a physician, a patient comes in, their routine medicines have failed, they have a diagnosis that works for medical marijuana in the state, they say they tolerate the side effects of marijuana. Well, the first rule of medicine is first do no harm. First day, first hour medical school, first do no harm. I got to tell that patient, okay, I might let you do that, but you got to tell me you're not going to smoke it. Even the people that do smoke it, I put my stethoscope in their ears, let them hear their windbags wheeze. That's what it's going to sound like, okay? So, that's the first thing. The second thing that I'd ask a patient is, it works, does it work well? Because the second rule of medicine is the patients are usually right. They have a clue as to what's going on and what they need. And the corollary of that is don't argue with success. So with that, I can authorize a patient. Now, I'm an emergency trauma doc, and I got out of emergency medicine because I'd go home and worry about my patients. Well, you know what? With these patients that are sick in hell, I go home and worry about them as much as I did about my emergency patients. You know why? Because I worry about that they're going to get busted growing marijuana, according to the state limits, because there's so many misunderstandings. What bothers me? Misunderstandings. Number one, you can't grow for yourself and somebody else. There's a lot of misunderstandings about that, and G.B. Brown in Thurston County learned the hard way. He had 15 plants and 24 ounces, but he's growing for him and his neighbor, and he's going down. He's going to jail because you can't grow for yourself. You can't have an authorization for yourself and somebody else. I worry about that with you guys, and I worry about anybody having authorization for more than 15 plants because Mason and Reed in Shelton, Washington, and Mason County proved that you have to have extraordinary documentation to have more than 15 plants. They want to know how much marijuana you use on a daily, hourly basis, how much you hurt, what your yield per plant is, how many plants per year. They need pictures and cycles. These guys that are growing over 15 plants, they are subject to going to prison. I'm telling you, it's happening. Somebody needs to be the wake-up call and the beacon. I'm telling you, the first rule of medicine is do no harm. That usually means don't start an antibiotic that's going to kill somebody or drop a lung when I'm starting a subclavian. But it also means informing the general public, dang it, that you're going to prison if you're growing over 15 plants or growing for somebody else. That's all I have to say, and my job of doing first do no harm for my patients. It's a little bit of patient education. Thank you.